Hi, welcome to another episode of Hot Takes. Going to talk about the Sandy Peggy case again. Not really much about the case. We all know that she's basically going to have to win against this madman, Dr. Beth Upton, the man who wants us to pretend he's a woman. The law is quite clear, and they have been breaking it, so much so that the Human Rights Commission in this country has written to them several times telling them this and demanding proof that it's changed. They want to see facilities, etc. And so Fife NHS know that they're in deep, deep trouble. They keep defending Beth Upton and insisting that it's acceptable for a biological man to expose himself in a room full of women in what is supposed to be a woman's safe space. And they are paying some very, very expensive law fees. And this is the point of this video. They have been asked under a Freedom of Information request, how much have they wanked away trying to defend the indefensible, even though they know that the law says the opposite of what they are trying to do. We're not telling you. It's a secret. But it's public money. Yes, but we can't tell you because it will make us look bad. We don't want to tell you how much money that should have gone into healthcare has been spent on legal fees so that this man can, pretend he's a woman. Even though none of the women in the hospital want it, even though it is breaking the law, and that we are going to get separately prosecuted for breaking the law regardless after this case. But we're not telling you how much we're spending on it. And that means they've spent an embarrassingly large amount of money on legal fees, haven't they? I wonder if it's up to £1 million yet. It's going to be a lot more when they've got 2 court cases coming towards them for breaching 2 different laws. What is wrong with these people? They should be forced to put out the cost to date and going forward to see if people think it's good value for money. And then work out how many operations would this legal charge have done? How many nurses could they have hired? How many doctors? Isn't this a complete and utter waste of time? And they know they can't win. They've already admitted that they're fighting a losing battle, and that the trouble they've got is if they lose, they lose. If they win, they lose more. Because if they win, they've then forced their view that men can go into women, which is against the law, which means that when they do get prosecuted, they've already admitted defeat before the case goes to the court. So they're actually going to lose big time secondly. So they can't win. This is the point. They need to just say now, actually, Dr. Beth Upton, you're a biological man. You went into a woman's safe space. It's contravention of the law. You're fired. FRO. And then fire the lawyer as well. Don't need you anymore. Pay them off. Get rid of them. And done. That's what you'd do if you had balls like, Dr. Beth Upton. But they don't. And they're stupid. And they're going to find out the true cost. But unfortunately, so are the patients of NHS Fife. And every other NHS board in Scotland. None of whom have a woman's safe space in their hospitals. Great, isn't it? Ladies, sue the arse. Let the fun begin, get the class actions up, and bankrupt every single one of them. Thanks a lot. Bye.